Good morning. It's Dr. Deuk Majan, CEO and founder of the Deuk Spine Institute. It is Tuesday, January 6, 2026. This is our first Deuk laser disc repair of 2026 at Deuk Spine Institute. Our patient travels here to Florida from Washington State. He has 4 degenerated discs in his neck. 4. C3-4, C4-5, C5-6, C6-7. And of those 4 discs, 2 of them are causing serious problems for him because they're pressing on his nerves and spinal cord, causing cervical brachial pain, which is pain radiating from the neck into the shoulder on the right side. There is some spinal cord damage. We can see T2 signal change on the MRI, which is T2 weighted images, sagittal and axial. You can see there's some bright signal in the cord. There's bad stenosis. Now, he was offered fusions. He did not want cervical spine fusion. He was offered laminectomy. Basically, he said, I don't want invasive surgery. I know the complication rate is very high. He found out about the Deuk laser disc repair and decided to come here and have the laser procedure done. Now, what we're hoping to achieve here with our surgery is decompression, get the pressure off the spinal cord and nerves to eliminate the symptoms he has of neck pain going into his shoulder and tingling, numbness into his right arm. So those symptoms are due to 2 things. Number 1, the herniated disc in the neck causing inflammation in the back of the disc called annular inflammation or annulitis at C3-4, C4-5, which causes the neck pain and headaches. And then the second problem is the pinching of the nerve going in his arm. So he wants to eliminate those arm symptoms. That's called radiculopathy. And then he also has some early myelopathy. So he's got 3 things: the neck pain from the disc, the radiculopathy from the nerve, and the myelopathy. Sean? All right, we're pretty close to C3-4 there. I'm going to start at C3-4. Shot. I need to aim up a little bit. Shot. Shot. Not too bad. Shot. AP. You're hitting my arm. You need to pull back as you roll over. Okay, too far to the right. I got to be able to see, Jordan. You're too low on the patient. Okay, go up. I can't see. Take it out. I can't see. Come on, Jordan. Shot. 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 AP. Pull towards you as you're rolling up. There you go. Now shot. All right, still a little bit to the right. Stay there. And he has really thin neck. Shot. All right, that looks good. Lateral. So I'm happy on my AP view with the positioning of the needle in front of the disc quickly. Lateral view, I'm a little bit lower than I want to be. Shot. All right. I've got quite a bit of bone spur out front. Shot. Yeah. That's going to be interesting. All right. I'm going to hold position here. And we're going to get another AP view. Quick shot. That's perfect. Lateral. All right. So we got some bone material in the front that I'm going to have to get through. Shot. But it's doable to get to the back of that 3-4. Everyone agrees it's 3-4?
Yes, sir.
All right, let's do a little numbing on the skin. I need some better light here, Dr. Burndes. I need your help. Get that light over here so there's no shadow on the right side. I need a Raytech.
How is that?
That's much better.
Okay.
I can actually see. All right, I'm numbing up the skin. Any questions, Henry?
At this moment, no current questions.
All right, while we're doing this, why don't you show the audience how these discs cause so much pain and symptoms for patients, and how we fix it.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963. Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Fine. Yeah, a little inline's good, but not right now. I'll tell you when. Welcome back. We are going through a bone spur in the front of his spine, and we're dead center. Look at that. Jordan, show us the center of the disc. That's right where the tip of our dilator is in the center of the spine. That's where you want to be on the AP view when you're doing transdiscal cervical endoscopic surgery. I'm placing my dilator through. On the lateral view, we're looking good. Well, we're just going through that little bone spur in the front, which some people have. His is probably the worst I've ever seen for the laser surgery. Now, I've seen big bone spurs in the front of the spine on patients when I was doing ACDFs. We're good. I did 1,000 ACDF surgeries in my career, 1,000, which is a lot, of anterior cervical discectomy and fusion combined with artificial discs. I've done under 100 artificial discs, but I've done over 900 ACDFs. So ACDF is a much more common procedure. All right, we're just getting to the back here of this disc, and I'm almost where I want to be. Just another millimeter and I'll be happy. All right, I'm pretty happy with that. Now I'm going to place this tube. Folks, if you could see this, this is the endoscopic dilator, endoscopic tubular retractor. This is the entire surgery is done right through the center of that. It's a hollow metal tube and it's going to slide over this dilator. We're going to place it in the back of the disc, right where the tip of the dilator is. Once I place this tubular retractor for the endoscope in, I'm going to remove the dilator and then I will be able to perform the surgery. So while I advance this tubular retractor, we're going to do it very carefully, very slowly. Keep an eye on the tip of that dilator, Luis. So we're going through the disc. Now on the lateral view, it looks like we're taking up the entire disc, but I'll show you the AP view in just a moment. You'll see we're not. We're literally in the center of the disc, and that's exactly where we want to be. But it's misleading because you're only seeing two-dimensional information. You need three-dimensional information to understand the navigation here. Almost there. Any questions?
At this moment, no current questions.
I'm basically advancing about a millimeter at a time. And the reason for that is I want to go very slowly. That's good. Because we don't want anything moving where it's not supposed to. All right, there it is. So let's get a quick AP. I'm going to show you this tube only takes up a small part of the disc. You can see it best on the AP. Now take a look at that right there. Jordan, show us the left side of the disc and the right side of the disc on that AP view. All right, look at the arrow. Go up. Up there. Yeah, so go from there, that's the right side, and go all the way to the left. That's the whole disc. So we're in a very small part of the disc where the tube is. You can see that. And we're at the back of the disc where I can do my surgery and get the pressure off his spinal cord and nerve roots. Any questions?
At this moment, no current questions.
All right, we've already shown the audience how discs become injured and cause neck pain, arm pain, headaches from inflammation at the back of the disc and the annulus fibrosis. I've been teaching surgeons this for 20 years. Unfortunately, they don't listen. They all want to keep doing invasive surgeries like anterior cervical discectomy and fusion, artificial disc, because let's face it, those surgeries pay a lot better than endoscopic surgery does. But endoscopic is really the future of spine surgery, and it's happening right here at Deuk Spine Institute today. Any questions from our audience?
At this moment, no current questions.
All right, we're starting at C3-4. I'm looking at the herniation right in front of us. Laser fiber is 0.5 millimeter, 0.45 millimeter. It's at 12 o'clock. There's a piece of herniation. We're just going to use the laser to remove the herniations. The herniations are stuck down to the annulus through scar tissue. And we're going to use this laser to remove as much as we can. Now, a lot of people think a herniation is one thing, you know, one piece of disc material, but it's not. It's actually many pieces. And you learn that and appreciate that best when you do endoscopic surgery of the spine. So we are at the back of this disc, and I will tell you, this looks horrible. There's so much arthritis here. It's one of the worst I've seen. This is not a nice soft disc herniation. Look at all the scar tissue and bone spur. This is 90% bone spur and calcified disc herniation and scar tissue. Okay? It's pretty horrible. This is the hardest type of surgery to do. Whether you're doing open ACDF, you're doing artificial disc, it doesn't matter. This is the hardest right here. The easiest is soft herniations that come out easily. They're soft like a marshmallow. You can get rid of them pretty easily with the laser. But this is, look at all that calcium right there. All of that is like a rock. There's the foramen where his nerve root is right there. That's a piece of herniation sitting right on top of his nerve. All right. Yeah, this is the worst possible type of herniation you can deal with. All right, and you don't know it until you get in here and you can see it. But I'm removing the bone spurs that are literally pushing on his nerve in the foramen right there. Okay? Now, this is actually calcified foraminal ligament and calcified herniation. So we want to get as much as we can without doing any damage to the nerve or to the spinal cord. To do that, I have to go back and forth. I'm going to flip this scope and I'm going to go left and right and alternate positions. That's a bone spur right there off the end plate. This is all herniation you're looking at and ligament called posterior longitudinal ligament. All right, so we are at the back of C3-4 and got a nice view. We had a little bit of bleeding earlier, but that bleeding you're seeing is just like literally drops of blood. But it's magnified, so it looks like a lot of bleeding, but it's not. Okay. All right, that's a bone spur. Thanks. My anesthesiologist is keeping the blood pressure under control. See the bone spur? We just melted away with a laser. People say lasers, aren't they dangerous? The answer is no, they're not. The reason this laser is not dangerous is because of the endoscope. If you do this laser without the endoscope, yes, it is dangerous. I agree. But when you use the endoscope and you can see everything beautifully like I'm seeing right here, You can see where the spinal cord is. You can see where the nerves are. You can see where the ligaments are. You can see where the herniation is. You can see the end plates. You see everything better than an ACDF or artificial disc. How do I know? Because I've done thousands of surgeries open with microscopes, and compared to the endoscope is really the best. Hands down, the best. Look at that piece of herniation right there. See how dense it is? And all that gold, orangey gold color is calcium. Basically calcifying disc herniation. And it doesn't want to float out because it's so full of calcium, which is really a metal, right? Think about your teeth. Your teeth are very hard because of calcium. Your bones are hard because of calcium. Okay, so look at that. Look at all that junk right there, sitting right on top of his nerves. Just crushing them. That's why this patient has been suffering with so much symptoms in his arms and neck. This tremendous amount of inflammation here. This is all just a giant plaque of scar tissue. It's calcifying right there, just sitting right on top of his spinal cord. You can. You what?
As soon as he was laying down, first when putting the monitors on,
Yeah.
he said his shoulder went completely numb.
Yeah, he's so. There's so much stenosis that my anesthesiologist, Dr. Berndes, is saying, as soon as he laid down on the operating table, his shoulder went numb. Yeah, completely numb. And that's because of all this stuff right here. This is all calcified ligaments called the posterior longitudinal ligament, calcified herniation at the back of the disc right here. So he traveled from Washington State, which is on the other side of the United States. It's a good 4.5 hour, 5 hour flight. He traveled here because he did not want to have invasive spine surgery. He did not want what the other surgeons were offering, anterior cervical discectomy infusions. They wanted to fuse his entire spine. He didn't need his entire spine fused, folks. He just needed these 2 discs fixed, and that's it. The problem is so many surgeons are so aggressive at doing these invasive procedures because, let's be honest, that's where they make all their money. And that's why they're recommending these treatments, because not only does the surgeon make the money, the hospital makes a lot of money. The implant companies, they make a lot of money, billions of dollars a year from surgeons recommending invasive treatments. But it's the patients who are suffering. The winners with fusions are the hospitals, the surgeons, the implant companies. The losers are the patients because they're getting an unnecessary procedure. Any questions?
No current questions, so we do have a comment and or seeking advice from Steve on YouTube.
Hi, Steve. Welcome.
Saying-
Steve from YouTube.
Saying, hi, doctor. I had a open ACDF surgery, C4-5, C5-6, and I'm still in recovery. It's been a little over a month and 2 weeks, and now I'm having really severe headaches that make me sick to my stomach.
All right, Steve, here's my recommendation. Number 1, notify your surgeon. Number 1, most important. Now, here's what it may be. You may have a spinal fluid leak, okay? Spinal fluid leaks are common with spine surgery with certain types of surgeons, not me, but certain surgeons. I won't say names, but I will say that there's a lot of spine surgeons who get spinal fluid leaks during their surgery. I don't get spinal fluid leaks during my surgeries, but it's a complication of spine surgery. It's well known. Look it up, spinal fluid leak after spine surgery. The most common symptom is headache. Now, you need to get that addressed right away, because if there is a spinal fluid leak and you're having headaches from it, you can drain so much spinal fluid out of your brain. Not only will you get a headache, but your brain will start to sag, and you could get a subdural hematoma, which is a blood clot outside your brain, which could be life-threatening. So you've got to be assessed for a spinal fluid leak. You've got to talk to your surgeon, okay? If there is no spinal fluid leak, and I hope to God there isn't, and you could also get meningitis as well. So if there is no spinal fluid leak, then your headaches may be related to the surgery, like basically not doing it properly, which I can help you figure out why you're getting these headaches. But I would need to either see you in my clinic or see you on Zoom. And we do free Zoom evaluation. But I cannot tell if you have a spinal fluid leak. You need a special MRI scan and possibly a radio tracer injected. That's why you need to go see your surgeon. I mean, if you were here, I could order the appropriate tests and figure it out. But you're not in my office, wherever you are, and you got to go see your surgeon and tell him you're worried about a spinal fluid leak. So they've got to work you up and figure out if that's what you have. Again, that's why I don't recommend going and getting invasive surgery like fusion. It's totally unnecessary, and people get complications, okay? You're living proof of that. Your headache should not be there. My patients don't have headaches, after their surgery. We get rid of their headaches with the surgery. Yeah, fine. Great question. All right, this is that right foramen at C3-C4. Really, really bad. There was that herniation. You guys saw me, I took it out. It was sitting right there on the nerve. That's the nerve down there, by the way, just underneath that little piece of bone spur. Now, lasers used endoscopically like this have an accuracy that is 1/20th of a millimeter. So if you take a millimeter, chop it into 20 parts longwise, this laser is so precise, it's 1/20th of a millimeter in its therapeutic effect. Surgeons, other surgeons, any other type of spine surgery in the neck, the maximum resolution they have is about 1 millimeter, okay? 1 millimeter. This is 20 times more accurate and precise, this laser, as long as you use it endoscopically, like I told you. It cannot just be stuck in there blindly and have accuracy. That's dangerous. All right, this area is looking good. I got rid of the herniation that was pinching the nerve. There's still a little bit more right here I want to get rid of. There's some more pieces of herniation coming out of the foramen on the right side at C3-4. But so far, this surgery is going really well. For the patient, it's a lot worse than I thought it would be based on his MRI. There is a tremendous amount of the scar tissue and calcified herniation right here. You guys are seeing that I'm using the laser to easily remove it. By the way, one thing we do at Deuk Spine, we do laser spine surgery, okay? We really do laser spine surgery. We don't just advertise it. We do it. We do it every week. And for those of you keeping track, this is laser spine surgery number 2,733 for Deuk Spine Institute. 2,733 surgeries with the laser endoscopically. We are probably the world's leaders in endoscopic spine surgery. Now, my colleagues don't like hearing that. My other neurosurgeons, they hate the fact that we're leading the world here at Deuk Spine, and it's not happening at Harvard or Columbia or the Barrow Neurological or UC San Francisco. So they don't like me very much. They want to put us out of business if they could. And that way they can go back to just doing fusions without anybody like me calling them out for doing unnecessary, dangerous spine surgery, which is what they're doing, by the way. Just so you guys are aware, this surgery you're watching, these other neurosurgeons and orthopedic spine surgeons, the ones that don't do endoscopic surgery, they are very much against it because it's going to steal their livelihood away from them. They're making so much money because they're doing invasive surgery, which is no longer necessary. But if guys like me are out here doing these surgeries, we make their surgeries obsolete. So if they get rid of me, then their surgery is no longer obsolete. Does that make sense? So we're constantly fighting the animosity of my colleagues who are performing old invasive types of surgery that are really unnecessary. Look at all this stenosis, narrowing of the foramen on the left side. at C3-4. That's the foraminal ligament, calcified completely. And we're vaporizing away all that calcium. We are opening up that space for his nerves to basically be uncompressed once again. Once I do this area right here, you're seeing the foraminal ligament, which is an extension of the ligamentum flavum from the back of the spine over into the foramen. I am literally opening his foramen right now with that laser. This is the future of spine surgery. You guys are watching it here today at Deuk Spine Institute, the leaders in endoscopic spine surgery. All right, just about done here. Wow, this is the worst I've ever seen. I think the worst I've ever seen. The bony stenosis of the foramen, incredible. All this junk is pushing on his nerves. And look at his discs are finally moving again. You know, you can see the movement, right? Look at the bones moving on the side. You guys see that moving? It wasn't moving before. He had a stiff segment. There was zero movement. Now we've given him movement. That's another thing that our Deuk laser disc repair procedure does. We restore movement. Now, I don't have any scientific evidence to prove that, but every time I do one of these cases, I see disc going from zero movement from all the scar tissue to now moving. Look at how dense this herniation is. It's like a brick, all hard. I can't even get it to float out. Here we go. There's a little piece. Okay. As soon as I get this brick out of here, we'll be done with this disc. Any other questions or comments?
Yes, we have a question from AAKK on YouTube.
Welcome back. Happy New Year, AAKK. Thanks for joining us.
Asking, with regards to any CSF leak resulting from surgery in a patient with an ossified PLL, what is the mechanism for the leak, and why is it avoidable with the Deuk laser disc repair?
That's a great question. So CSF leaks come when the surgeon goes too far and basically gets into the dura, D-U-R-A, and then punctures the arachnoid, which is under the dura. So the first mistake is getting into the dura. You never want to go into the dura. All right, the dura is the tough membrane around the spinal cord and nerves. It basically houses the spinal cord and nerves plus the spinal fluid, which is the liquid just outside the spinal cord in the subarachnoid space. So basically the mechanism is the surgeon went too far down to the spinal cord and went through the dura, went through the arachnoid membrane, and basically is allowing the spinal fluid to leak out from the arachnoid through the dural hole and into the disc space, really into the epidural space where it drains down by the feet. Okay? So that's the mechanism. And it happens, unfortunately, with a lot of spine surgeons who are not very good. I'm just going to say it. As far as an OPLL, OPLL is ossification of the posterior longitudinal ligament. It's where your posterior ligament gets scarred and calcified down to the dura. The key here is don't do that type of surgery and stay out of the dura. Know your limits. Get the decompression done, but leave a small rim of calcification stuck to the dura alone. Do not try to remove it. That's my opinion. That's what I was taught, and I agree with that teaching. Do not try to get 100%. Try to get 80, 90%. And be careful. You have to use the right equipment, the right technique. You have to be cognizant of the issue, aware that it can happen, so you can avoid it. How does the Deuk laser disc repair avoid it? You're watching it right now. There is some OPLL here, not a lot. It's mostly calcified disc rather than OPLL. And what I do is I avoid going through the dura. I know where the dura is, and I'm a very good surgeon. I avoid it. Lots of surgeons have no clue where they are. They get lost. It gets bloody. They don't have good visibility. They don't have good dexterity. They don't have the right equipment. They don't have the right training, and they make mistakes. And that mistake causes the patient a horrific side effect or complication. And that's probably what we're dealing with, if you ask me. with that guy with the headaches. All right, so I'm almost done removing all the herniation, but some of these guys are so heavy, they're just like little anchors. They don't want to float out. How are we doing on irrigation? All right. So I'm having to chop them up into small pieces before they'll come out. You guys see this? I mean, normally things this size just float out with hydrostatic pressure of my irrigation. However, that's a piece of herniation. That's a more recent one. It's all scarred and it's calcified, but I have to cut it in half to get it out of this tube. Remember, the internal diameter of the tube is 2.8 millimeters, so it's not like it's big. It's not big. It's very small. Any other questions?
At this moment, no current questions.
Yeah, what we're doing here is a lot of extra work just to get these pieces of herniation to float out of the tube, up and out of the chimney, like smoke going up and out the chimney. All right, just about done with C3-4. Then we're going to move down to 4-5. Any other questions?
At this moment, no current questions.
All right, let's show the audience why the Deuk laser disc repair is better procedure than some of these other treatments out there that surgeons are prescribing, like ACDF or, injections. I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. I'm here to talk to you today about neck pain and its common treatments. Neck pain has different causes. The most common cause of neck pain is a herniated disc. Herniated discs account for about 85% of chronic neck pain. The second most common cause of neck pain that's chronic is the facet joints. There are facet joints on both sides of the spine, left and right. There is one facet joint for every disc. Facet joint pain requires a different kind of treatment targeted at the facet joint itself. For disc pain, which accounts for 85% of neck pain, the best treatment in the world is the Deuk laser disc repair. It is the most advanced treatment that is the safest and has the highest chance of successfully eliminating symptoms. Let's talk for a moment about what's important for patients who are considering treatment for neck pain coming from an injured or damaged disc in their spine. The most important thing for patients, number one, is getting rid of their symptoms. The type of symptoms that disc herniations or disc injuries can cause include neck pain, headaches, and symptoms down the arm, such as weakness, numbness, tingling, or even pain shooting from the neck down into the arm. The symptoms of neck pain include disc herniations, which are the most common cause, and patients want those symptoms gone. That is their number one priority and goal. The second most important goal for most patients is to avoid a complication from the treatment. Medical treatments do have complications, and the more invasive the treatment, the more likely a complication will occur. Complications from surgery, for example, can include blood clots, pneumonia, heart attack, infection, failure of the spine to heal properly after surgery. There can be implant migration or implant failure, adjacent segment disease, and vascular complications such as injury to the blood vessels or nerves in the neck, including the trachea and esophagus. Nobody wants a complication from spine surgery on their neck, so less invasive is typically going to be a better option to avoid those complications. The third thing patients really want when they're looking at treatment options for curing their neck pain is they want a quick recovery. People want to get back to a normal life as quickly as possible. They want to go back to their activities, they want to be active, they want to play sports, and they want to go back to work. And finally, the next thing to consider is long-term results. For example, if you have a treatment today and it works, how long will that treatment last, and will it create additional problems down the road for you? Treatments like spinal fusion that are invasive typically result in the need for additional treatments such as pain management, physical therapy, and possibly additional surgery. We're going to look at each of these individually and go through each of these options individually. So we're going to start with more invasive treatments that are typically recommended for patients with herniated discs or degenerated discs in their neck. The most common treatment recommended around the world is anterior cervical discectomy and fusion. That is a surgical treatment where the entire disc is removed surgically through a large incision. It is very risky. There's bleeding associated and risk of injury to surrounding structures such as the esophagus, trachea, and blood vessels in your neck. Complications are very common with this type of surgery. The complication rate is accepted at 48%, which is a very high number. So if you're considering ACDF or anterior cervical decompression and fusion, you are looking at a very high complication rate. The success rate of this surgery at eliminating neck pain is very low. It's somewhere on the order of 25%. That is the generally accepted success rate at eliminating neck pain. An additional treatment that you can consider is artificial discs. Artificial discs are very similar to ACDF. The difference is instead of fusing two bones together with a metal plate and a cage, we're actually putting in a mobile disc made out of metal and plastic that moves. The problem with the movement is that these discs do pop out of the disc space. Over time, they can fail. They can cause collapse of the vertebral body above and below through fracturing, especially in patients with weak bones, such as osteopenia or osteoporosis. Those types of patients are at high risk for complications from both ACDF and artificial discs. Another complication from artificial discs is that you can develop facet joint pain and adjacent segment disease. Very common with artificial discs and fusion, and they typically have the same rate of adjacent segment disease. There's also a long recovery associated with both ACDF and artificial discs. Recovery can take months to years, if recovery even happens at all. There's tremendous scarring in the wound associated with ACDF and artificial discs. Lots of scar tissue, lots of pain, and lots of problems after these surgeries that are invasive. Alternative treatment would be to go in the back of the neck and do a cervical laminectomy and fusion. Again, large incision, high chance of complications, very long recovery, taking years to recover. All three of these types of surgeries, ACDF, artificial discs, and posterior cervical laminectomy and fusion, require the use of postoperative narcotic painkillers. Narcotic painkillers are opioids. They are dangerous. People get addicted to them, they can be abused, and people can overdose. It's easy to overdose on narcotics because you want to keep taking them to treat the severe pain you're going to have after these invasive type surgeries. The severe pain can last weeks or even months, and the addiction can happen very quickly. Let's move into less invasive treatments such as epidural steroid injections. This is a treatment commonly recommended by pain management doctors. They stick a needle into your spine and inject the steroid medicine to reduce inflammation. While this treatment can be effective at temporarily giving you relief for a few days or even a few weeks, the pain always comes back from a herniated disc because the source of pain is never being treated. The annular tear and inflammation within the annular tear is not treated by an epidural steroid injection. The steroid goes throughout your body and causes systemic side effects such as high blood pressure, elevated blood sugar. In patients with diabetes, this could put your sugar up into the 300s and 400s, which is very dangerous for patients. So steroids should be avoided as much as possible. Next, let's turn to spinal cord stimulators. The problem with spinal cord stimulators is they are highly invasive and they are frequently put into patients by untrained doctors who are not surgeons. These doctors are typically pain management specialists, and they're putting these stimulators in patients not because they can cure your pain, but because it's another treatment that they have up their sleeves. These treatments with stimulators pay these doctors obscene amounts of money. The profit for the doctor can be in the tens of thousands of dollars. Avoid spinal cord stimulators. They do not work. They're dangerous. They put you at tremendous risk, and in the end, basically you're taking this device, sticking it on top of your spinal cord and putting a pacemaker under your skin that you're going to have to live with for the rest of your life. They cause scar tissue and they frequently migrate and get out of position. Next, we're going to talk about physical therapy. While physical therapy has many benefits, such as keeping you toned and fit while you're struggling through the pain and trying to stay mobile, but physical therapy will never, ever cure pain in the neck from a herniated disc. It will just try to keep you active and from getting more and more sedentary and developing deconditioning of your muscles because you're sitting around because you have neck pain all the time. Finally, let's talk about the Deuk laser disc repair. The Deuk laser disc repair is the solution for neck pain. If you have a herniated, bulging disc, extruded, ruptured disc, protruded disc, or degenerated disc, the Deuk laser disc repair works by minimally invasive treatment, going to the back of the disc where the problem is coming from. This is the tear in the back of the disc that has inflammation, and using a laser that is extremely precise. The laser fiber itself is 0.5 millimeter or half a millimeter wide, and the endoscope allows me to see 1/20th of a millimeter. I can directly see the nerves and spinal cord. It is an extremely safe treatment. As far as results go, the Deuk laser disc repair has the highest success rate of all the treatments we've discussed so far. We have a 99% cure rate of neck pain coming from herniated discs, and the Deuk laser disc repair has 0 surgical complications to date. Our patients have an immediate recovery. In 1 hour, they're leaving our facility and they're going back to their hotel room. They usually drive themselves in the next morning for a quick checkup, and then it's back to a normal life. Well, I've enjoyed talking to you, and thanks for taking the time to listen to our video. I'm Dr. Ara Deuk-Machen. We'll also find this on our podcast at Deuk Spine Institute Podcast. Thank you. Welcome back, and we are working on C4-5 disc herniation, and you can see the herniation there at the bottom of that tube, and it's pushing on the spinal cord and the nerves. This disc, I got to tell you, is a little different than the last one. It's not as much bone spur calcification as the last one, but there's a lot of scar tissue. So what produces the scar tissue at the back of the disc where the herniation is something called inflammation. And inflammation is what we talk about all the time here at Deuk Spine, because it is the cause of all the symptoms these patients have. Inflammation. Now, when you have pain, you have inflammation. So the numbness and weakness comes from pressure on the nerve, and that's what we're treating right now. It's called a decompression. So by decompressing the nerve and the spinal cord, we get rid of the nerve symptoms, but nerve symptoms are not pain. Pain is not from nerve pressure. Pressure on nerves causes weakness, numbness, and tingling. It does not cause pain. It is one of the biggest myths or mistakes out there is that people believe that pressure on the nerve causes pain, but it doesn't cause pain. It causes weakness, numbness, tingling. All right, we'll take our questions.
Got me from AAKK once more
Yeah.
on YouTube, saying Happy New Year to you as well, Dr. Deuk. With regards to the ossification of the foraminal ligament, how do you stay in the safe zone to avoid the exiting nerve and vertebral artery?
Yeah, the way I stay in the safe zone is by knowing my anatomy and doing thousands of surgeries on thousands of discs. It's not something that somebody can just listen to what I say and be able to do it. You have to understand, my training was the best neurosurgical training in the world when I was trained back in 1997 to 2004. I went to the #1 neurosurgery training program in the world, the University of Florida in Gainesville. And because of that, I was trained by the best, and I had the best opportunities to learn from them in the operating room, standing and working and assisting these spine surgeons, okay? But also it comes down to the individual. Before I even went to my residency at the University of Florida with Dr. Roten, Dr. Art Day, Bill Friedman, Parker Mickle, I hate to say the name Pat Jacob, but Jeff Henn, Richard Fessler, these are the top neurosurgeons in their fields. Before I even went, I was the champion of neuroanatomy in the world. There is only one competition for neuroanatomy in the world, and it's called the Retzius Neuroanatomy Competition. It's held in Los Angeles every year, and it's in honor of Gustav Retzius, the Swedish neuroanatomist. And the highest score in that test receives the distinction of being that year's champion of neuroanatomy. I was the Retzius neuroanatomy competition winner in Los Angeles in 1996 at Children's Hospital of Los Angeles. As a matter of fact, this test has 50 questions of neuroanatomy, and I scored 49 out of 50 correct, the highest score anyone ever received in the history of the test. I made one mistake, and it was something I'd never seen called foramen cecum, which is a small little channel in the front of your skull from the inside. It's a vestigial foramen, which is part of your embryological development, which is not present in adults. So not only did you have to know adult neuroanatomy, but also pediatric neuroanatomy and embryology, neuroembryology. So it's a very prestigious test, and I scored the highest score. I have the Gustav Retzius Neuroanatomy Trophy sitting at home in my office. And long story short, you can't just ask me, you know, how do I become a superstar in neurosurgery? Can you tell me over this Zoom conference or over this broadcast? No, I can't. It really comes down to many, many years that I studied all of these sciences and medicine and put it all together to avoid injuring things during my surgeries. So it's not one thing, it's many things. It's a culmination of all my training at top med schools, top residencies, top fellowships, and of course afterwards during my practice, where my patients taught me for many years how to be the best surgeon possible. This comes from knowledge and understanding, deeply rooted in my education. That's why I think education is so important. Unfortunately, there's this movement today to minimize the value of education in our lives. But educated people are problem solvers. That's the plain and simple truth. You can't be a problem solver if you're not educated. I don't mean educated like university education, though that's important. I mean educated as in being aware of facts around what you're trying to solve. Okay? There is no substitute for a good education. Single most important thing in my past that I have the highest value for, because it's made me who I am today. Education. All right, there it is. Look at that herniation. That thing is huge. It just popped out of the foramen at C4-5 on the right side, which was pushing on his nerve root. It will not come up on its own. I have to break it down into smaller pieces. Look at the laser, how well it does that. This is the only tool in the world that can do this. People say, why do you use the laser? You're witnessing why we use the laser. And if you've tried using metal instruments in your career, you'll know that it's impossible to do with a metal instrument what I just did. Even if you said use a drill, drills don't cut soft tissue. Drills like our, Stryker drills that we have, or Medtronic drills, they cut bone, not soft tissue. And this is scar tissue. It will never cut with a drill. So the only way to get rid of this is with a laser. And Deuk Spine Institute, we are the leaders in the world in laser endoscopic spine surgery. We have patients that travel from all over the world to get surgery here. This patient traveled from the other side of the United States in Washington State. We are almost done with his surgery. Look at that big piece of herniation, all scarred up and calcified. It doesn't even want to float out. It's so heavy and dense, it just sinks. Normally we can float these things out because they're not so dense. But this density is what's keeping it from coming out. Any questions?
No current questions, so we do have a comment coming from AAKK once more on YouTube saying, excellent explanation, Dr. Deuk. Congratulations also on the Retzius Award. Your patients are blessed to have you at their surgeon as their surgeon, and your drive for excellence is inspirational.
Oh, thank you, AKK. I hope it is. That's the most I can hope, is that people like you who want to be the best at what you do, learn from the best, and then do what we do, you know, to become the best yourself. All right, we are now in the foramen, and that's a piece of herniation right there. Look at that, more foraminal herniation. And unfortunately, these pieces of herniation are literally coming out of this foramen, and they're slipping underneath my tube, and they think they're escaping me, but they're not. I'm going to get them in just a moment, but I want to stay focused right here on the foraminal decompression. Look how nice and open the foramen is now. You can see the uncinate process right there. I'm removing bone spurs off the edge of the uncinate process, and there is a little more foraminal ligament, but all the herniation is gone. Now I got to turn to the other side and basically get rid of these pieces of herniation that tried to escape, and I'm going to break them down into smaller pieces and get them out of the tube. Okay, so I'm literally yeah, come on. I am using the laser to vaporize tissues here and break them down into smaller pieces. You guys are witnessing that big piece get shrunk down, and now it can float out. You see that? And that's what we do. That's how the Deuk laser disc repair works. It's all about debulking these little tumors or masses, these herniations, releasing and debulking them. Release and debulk, release and debulk. Debulk. All right, just about done. I got 2 minutes left. Berndes?
Thank you.
You guys see that? Pretty cool, huh? That's the dura down there, that white stuff. And we're pretty much done. I just got to get this last little piece that's pushing on the nerve right there, and we're done. That's good. Let's just look the other direction one more time. Got that little guy right there, sneaky little guy, trying to hide. All right, any other questions?
Yes, we have a question from Lioness Blessings on YouTube asking, how much is it?
Sit it on, please. Thank you.
Well, the cost of surgery depends on what we're doing. So the more we do, the more money it is.
So what, please? Thank you.
It just depends on what's needed. So if you're someone who has a problem with your spine and you want to know what's needed to be done to fix you, you can set up a Zoom call with me, and we do what's called a free MRI review. I'm going to look at you and examine you. I'm going to look at your MRI scan, and I'm going to make a recommendation for you depending on what needs to be done. So everybody's different, and that's why we customize each person's treatment to their specific needs. I got this. So I can't give you a price unless I know what you need done. Besides, I don't have the pricing anyway. It's really the business office that handles that. Any other questions?
No current questions.
All right, folks, here it is. Look at his neck. He's got a 5mm incision, and we lost probably 2 cc's of blood, which is nothing. And we fixed 2 degenerated herniated discs. I think he's going to do fantastic. He's going to go back to Washington State, a happy man. We don't give our patients any narcotic painkillers after surgery. If you have invasive surgery like laminectomy or discectomy or artificial disc, you're going to have narcotic painkillers for weeks to recover. Plus, all the trauma of the esophagus, trachea, and soft tissues is horrible. I'm showing you guys the piece of herniation. You see that? Can you see that on the tip
Yes,
of my
we do.
finger? That's about 3 millimeters across. That's about as big of a piece of herniation as we can get out for cervical. And the point is we took out about 20 of those. All right, everybody, thanks for joining us. We'll be back next with a 3-level lumbar Deuk laser disc repair. That's endoscopic spine surgery on the lumbar spine from a patient who traveled all the way from Colorado. Colorado. So he came from Colorado, the beautiful state of Colorado, and we're going to be fixing his back. So please join us. Thanks, Henry.
Of course.
And good morning, I'm Dr. Deuk Machen, CEO and founder of Deuk Spine Institute. I'm here with one of my patients who underwent the cervical Deuk laser disc repair for herniated discs in his neck at C5-6, C6-7. You can see in the video, we're in there with the laser cleaning out the herniations, and he had about 35 herniations in his disc that came out through the tube, released by the laser. Now, why did you come to Deuk Spine Institute? What kind of problems were you having with your neck?
Really, anytime I turned my neck to the left or looked straight up, or turned my head to the left or looked straight up, I was having excruciating pain, originally going down my arm and then pins and needles.
So you had a pinched nerve in your neck?
Yes,
Pinched
basically,
nerves.
yes.
Yeah, and we call that cervical radiculopathy. Do you still have that pain today?
No,
Gone.
not at all. Gone.
Yeah.
Yes.
But you're still nervous about turning your head.
Still nervous about turning my head. Yes.
We call that guarding.
Right.
And it's going to take you a while to realize you can turn your head. And turning your head won't reherniate. You know, the reherniations come from snapping forward only.
Okay, good. That's good to know.
So how long did you have the pain from the neck down into your left arm?
Honestly, about 10 months.
10 months.
Yeah, it just wasn't going away.
Was there an accident that happened?
No, I have no idea. It's probably past things happened to me in the past in the military and such, but it just aggravated one day. This had been ongoing for decades. Occasionally something would happen. But this time, and it would usually go away within a month, but this time it's stayed and got worse.
So there you have it. People who injure their discs, they end up having episodes of pain and symptoms that come and go. That's the first phase where it's intermittent. And then you get to a phase later on where it just comes and it never goes away. It's constant. And that's been going on for you for the last 10 months. But prior to that, decades you had intermittent
Decades,
symptoms.
yeah.
So I think it's good to get it fixed while you're in the intermittent phase. Then you don't have to worry about the permanent phase.
Yeah, I wish I had now.
But you didn't know, and it's
Right.
fine. How do you feel today?
Fantastic.
Yeah.
That I can actually turn my head to the left again and look up like I did in the office in here with my wife just now. So,
How
very
did it-
exciting.
Good. How did this pain affect your life?
It affected me in a big way because I'm still working. So very difficult to work, being that I'm out on sites all the time, walking manufacturing facilities and things of that nature with customers. And so I couldn't look up, I couldn't turn to the left. There were a lot of things I could not do without being in agony. So I was having to basically cover it all up and be miserable and sit in the car after every meeting and wonder how I was going to make it through the day.
How did it affect life at home?
Same. Life at home, the same. I couldn't enjoy my time at home. My wife and I loved to entertain and loved to be out with people. Everything came to kind of a screeching halt because I was recovering from my work weeks. And so it was bad altogether.
Now you're doing fantastic. So anything you want to say to your fans out there?
Highly recommend Dr. Deuk. Amazing from beginning to end. Had nothing but wonderful treatment. Very happy. Thrilled that we found you. Much appreciative of it. Highly recommend you guys. And I will be giving you the 5 stars on the Google.
Oh, thank you so much. Hey, it's a pleasure. And you're a
Appreciate
local
it.
guy, so it's nice to have some local people come in and get treated as well. We have so many people from all over the world now, but it's good to see local people.
Glad to be here.
All right, you take care.
Thank you very much.
All right, let's get you out of here.